Well, congratulations on undergoing rhinoplasty. We're so excited to see your final result, and we're so grateful for the trust that you've placed in me and my team. And we're just really excited to see how everything heals. We have a lot of out-of-town patients and also busy local patients here in Denver, and one of the most common questions I'm asked is, when can I fly after surgery? I'm sure you have the exact same question. In general, you can fly within about a week of surgery. That allows us to get you through your first post-operative appointment. Typically, most, if not all, of the bruising has resolved. And there should be a little bit of residual swelling, but with a small amount of makeup, that should be really well camouflaged. You can fly within a week, so if you're flying back home or if you're flying for business, all I ask is that you're very careful loading your bags in the overhead compartments. And when you're getting up to deplane, be very careful that nobody grabs their bag and hits you in your brand new nose. But in general, you can fly 1 week following surgery. Another common question that I'm asked is, when can I wear glasses or sunglasses following surgery? My typical advice is that it's okay to wear light frames or light sunglasses within a week of surgery. But if you notice that these are causing large indentations on the skin of the bridge of your nose, or if they're causing moderate to more severe discomfort, wait 1 more week and then try again. Contacts are perfectly fine to wear immediately following surgery. We receive a lot of questions from our patients early after rhinoplasty about their sense of smell. It can sometimes be heightened, it can be diminished, you might sense odd smells. Those are really, really common. The sense of smell is actually way up high in the bony vault of the nose, and a little bit of swelling following surgery can either completely obstruct that area or it can change airflow through that area. So it's not unusual for the sense of smell to be stronger, weaker, a little bit different, even for up to 3 to 4 weeks following surgery. It's fairly uncommon to see any changes at all in your sense of smell after 2 to 3 months following surgery. So you're probably wondering, as all of our patients wonder, when are you going to see your final result following rhinoplasty? The good news and the bad news is that healing can take even up to 12 months following surgery. But with my chosen approach, which is the endonasal or closed rhinoplasty approach, we typically see something very close to the final result within 1 to 3 months following surgery. Technically, it does take a full year to heal, but we don't see very many significant changes between that 3 to 12 month period. That can seem like a long time, but it's just around the corner. You're probably wondering when you can blow your nose following surgery. Our general advice is to not blow your nose in the first week following surgery. We suggest that you spray a little bit of saline spray into your nose and then sniff to clear your nose. But the good news is that you'll be able to blow your nose immediately after removal of your splints and trimming of your sutures at your 5-day post-operative appointment. I also advise patients to go home at that point, take a nice, long, warm shower, get plenty of steam and humidity into your nose, and that'll allow you to blow your nose in the shower and really clear out anything that you're trying to remove from your nose and really clear out your airway. I hear a lot of questions about what sprays you should put in your nose after rhinoplasty. Saline spray is a great option. That'll help keep your nose hydrated, moist, and clean. I always advise patients to avoid using Afrin. Afrin is a decongestant spray. It can really open up the nasal airway. It can decongest all your tissue, but if you use that for more than 2 to 3 times in a row, your nose can develop a medical condition where you're dependent on it. So the only instance where I recommend using Afrin or decongestant sprays is when you're having a nosebleed and you and I have spoken and we've decided that that's the best course of action. So saline sprays are great. You can use them 10 times a day if you want to, but I would avoid using any medicated sprays or anything like Afrin. We also oftentimes recommend steroid sprays for swelling inside the nose, but I would wait at least a week to start those. And in general, those are otherwise very, very safe. But in the first week following surgery, I would stick to saline just to keep your nose moistened and hydrated and clean. You're probably wondering when you can have a massage where your nose is in that little donut, or when you might be able to have a facial or extractions on your nasal skin. And in general, those are perfectly safe within 4 weeks following surgery. But if either of those activities cause anything more than mild discomfort, I would either try to change your position or change the way the treatment's being done, or delay that treatment for another 2 to 3 weeks. A lot of our patients ask when they can swim following rhinoplasty. Typically, swimming in any kind of water is acceptable after 4 weeks of healing. I find that swimming in pool water that's chlorinated is probably the safest because that water is fairly clean. Swimming in the ocean, in lake or stream water, or going into a sauna or a hot tub can always expose you to bacteria that can create larger problems. So I would definitely wait at least a month to go swimming in any sort of fresh or hot water, but chlorinated water is perfectly safe at 1 month's time. All of our patients love to exercise, so we're always fielding questions from patients after rhinoplasty about when they can go to the gym, when they can do cardio, when they can ski. Physical activity is perfectly fine after 1 week of healing. I release everyone to full physical activity at that point, but I do recommend starting at about 50% intensity. So don't go out and try to set a personal record 7 days following surgery. Start at about 50% and kind of work your way up to 75% at 2 weeks and 100% at 3 weeks. Skiing also is perfectly safe around 3 to 4 weeks, but my main concern is twofold. One, I don't want you to slip on the ice and hit your nose. But two, I'm really worried about ski goggles putting pressure on the nose and shifting the nasal bones or the nasal cartilages. So I would recommend waiting to ski or snowboard for at least 1 month.